How healthcare students should study research. Hi everyone, and welcome to our channel. Today, we're diving into a topic that so many nursing and healthcare students find intimidating: research. If you've ever felt overwhelmed by dense academic papers filled with complex language, you are definitely not alone. But here's the good news: building research literacy doesn't mean you need to become a full-fledged scientist overnight or understand every single statistical detail perfectly. It's simply about learning how to understand evidence at a foundational, academic level. This skill is absolutely crucial, not just for passing your exams, but for becoming a competent and confident healthcare professional. So, let's break it down together, step by step, and make research feel a lot more approachable. First things first, let's get to the core of why research even exists. At its heart, research is all about answering questions and reducing uncertainty in our healthcare knowledge. Think about it. Every procedure, every treatment, and every piece of advice we give patients is backed by years of inquiry. So, instead of getting bogged down by the methods and the numbers right away, I want you to start with the why. Always look for the research question first. It's usually stated clearly in the introduction or abstract. This question is your roadmap. It tells you exactly what the study is trying to discover. Understanding the question gives you context for everything else you read. Is the study trying to compare to different treatments? Is it exploring patients' experiences with a certain condition? Once you know the goal, the rest of the paper starts to make a lot more sense. The next critical step is to recognize the type of study you're reading. Not all research is created equal. Different study designs provide different levels of evidence and reliability. You might hear terms like randomized controlled trials, cohort studies, or qualitative interviews. At this stage, you don't need to be an expert on the methodology of each one. Just learn to identify the basic categories. For instance, a randomized controlled trial is often considered a gold standard for testing an intervention because it minimizes bias. On the other hand, a qualitative study offers deep insights into human experiences that numbers can't capture. Knowing the type of study helps you understand the strength of its findings without needing to memorize complex statistics. It's like knowing the difference between a direct eyewitness account and a story passed through several people. Both can be valuable, but you interpret them differently. Now let's talk about results, the part of the paper where many students get lost in a sea of p-values and confidence intervals. My advice: read for meaning, not just for numbers. Ask yourself simple, practical questions. What actually changed in the study? Did the new treatment lead to better outcomes? Did patients report feeling better? By how much? Try to translate the statistical findings into a real-world narrative. If a study found a statistically significant improvement, what does that actually mean for a patient? Does it mean they recover 2 days faster? Or does it mean they have a slightly lower chance of a minor side effect? Focusing on the so what makes the data much more tangible and memorable. This approach helps you see the bigger picture and understand the clinical relevance of the research. Of course, we can't talk about research without mentioning bias. Bias is anything that might skew the results and lead to inaccurate conclusions. It's essential to always read with a critical eye. Think like a detective. Who funded the study? A study funded by a company selling the product's testing might have a conflict of interest. How large was the sample size? A study with only 10 participants is less generalizable than one with 10,000. What information might be missing? Did the researchers only report the positive findings and ignore the negative ones? Acknowledging potential bias doesn't automatically invalidate a study, but it helps you weigh the evidence more carefully. It's a key part of responsible, evidence-based thinking. So, what does this all mean for you as a student? Developing research literacy is about so much more than just acing an assignment. It supports your ability to think critically and use evidence to inform your understanding, which is the foundation of evidence-based practice. It builds your confidence when you're rereading dense textbooks or tackling tricky exam questions that require you to apply concepts. Ultimately, it transforms your learning from passive reading into active, critical understanding. This skill will not only help you succeed academically, but will also prepare you for a career of lifelong learning in the ever-evolving field of healthcare. It empowers you to stay current, question practices, and contribute to providing the best possible care for your future patients. Thank you so much for watching. I hope these tips help demystify the world of research for you. If you found this video helpful, please give it a thumbs up and subscribe for more content to support you on your healthcare journey. Let me know in the comments what other topics you'd like to see. See you in the next video.